So I'd like to welcome everyone today for this talk, Arts-Based Research and Sensory Methods in Transplantations. Can frictions move the field? The University of Alberta acknowledges that we are located on Treaty 6 territory and respects the ancestral and contemporary histories, languages, cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence marks the condition of possibility for our vibrant university community and challenges us to find ever better ways to support and celebrate the sovereignty and well-being of First Nations peoples. I'd also like to thank you to Paladin for their support of the ATI seminar series and to welcome all of you here today. My name is Yelena Glesman. I'm an assistant professor here at the University of Alberta in the Science, Technology, and Society Studies program and the Department of Art and Design. And I'm very excited to welcome Suze Berkhout and Brad Necyk today. Suze Berkhout is an assistant professor in the Department of Psychiatry here, an affiliate of the Institute of the History and Philosophy of Science and Technology at the University of Toronto, She's an early career clinician investigator and practicing psychiatrist. Her program of research in feminist philosophy of science, science and technology studies, what we call STS, utilizes ethnographic, narrative, and arts-based qualitative methods to explore social and cultural issues impacting access and navigation through healthcare systems. Along with Dr. Kelly Frisch at Carleton University, Suze leads a new frontier exploration project that brings together science and technology studies, critical disability scholarship, and artistic research creation to generate new knowledge in solid organ transplantation, focused on lived experience and the challenges that span the whole of transplant's temporal frame, looking to how these might be better understood in embodied sensory ways through artistic practices. Her other areas of research use similar approaches, focusing on treatment refractoriness in mental health and the ways in which placebo and nocebo effects model biosocial meaning. So very fascinating work, and we're very, very excited to hear from you today, Dr. Berkhout. And we also would like to welcome Brad Necyk, who is a visual artist and writer whose practice focuses on mental illness, empathy, consciousness, and flourishing. He recently completed a research creation PhD in psychiatry at the University of Alberta here, and his doctoral research was awarded the Governor's General Gold Medal. His artistic work was included in the 2015 Alberta Biennial at MUTEC 2021 and has been shown internationally, most recently in Santa Cruz, California, and Shanghai, China. Necyk is a postdoctoral fellow currently at York University with VISTA, which stands for Vision, Science to Applications, and in cinema and media arts, creating works on addiction, organ transplantation, and medical assistance in dying. He will be collaborating with the Frictions team to create XR, or extended reality, which is augmented and virtual reality, through stories and films. And we're very welcome you both here today. And I think for those who are in the audience today, during the talks, if you have questions that you'd like to put into the chat, we will have a Q&A at the end. And I'll be very happy to moderate that. So feel free to add questions into the chat as we go at any point. All right, so without further ado, yes.
It's a pleasure to be here virtually online. And I'm speaking to you from Toronto, or Toronto, which is Treaty 13 territory, and home to diverse First Nations, Inuit, and Métis people. Toronto is the traditional lands of the Haudenosaunee, the Wendat, the Huron, the Anishinaabeg, and the Mississaugas of the Credit. And as we share in our teaching and learning today, may we pay respect to the knowledge embedded in traditional Indigenous custodianship of this land. I have a few disclosures. So I'm funded for some of the research that I'll be talking about today through the New Frontiers Research Fund, as well as SSHRC and the CDTRP, the Canadian Donation Transplant Research Program, as well as at University of Toronto, the Critical Digital Humanities Institute, and then other projects that I carry out are funded by CIHR and the University of Toronto Psychiatry Excellence Fund. I'm also on a data safety monitoring board for an extended dosing or deprescribing trial in schizophrenia. And Dr. Necyk has received support from the Canada Council for the Arts, and his postdoctoral work is also funded in part through the New Frontiers Research Fund grant, as well as through VISTA. So in thinking, I want to sort of start us off by thinking a bit about qualitative research and qualitative research within the field of solid organ transplantation. And in thinking about qualitative research, one of the things that a lot of qualitative researchers would do is to position themselves in relation to the work that they're doing, because qualitative researchers themselves, their own bodies, their own perspectives are a vehicle through which the qualitative research actually transpires. So your own positionality is important. And so in terms of my positionality, I am someone who's very interested in solid organ transplantation, but I come to the field as a kind of a newbie. So I haven't been doing research in transplantation for for a very long time by any means. I certainly don't have the kinds of experience that a lot of you folks would. And I only do a tiny little bit of clinical work that intersects with transplantation. So most of my psychiatric clinical practice is in adult inpatient psychiatry, but I do see some transplant patients from time to time when I'm covering consult liaison psychiatry services. I also come to the work as someone who is a feminist philosopher, and I work in science and technology studies, or STS, and I am certainly on the privileged side of settler colonial relations. I'm someone who comes from a position of critical allyship in the area of disability scholarship, and the work that I'll be talking about really brings together a lot of these different perspectives. Now, in terms of the field of transplant research and where qualitative research sits within that, I wanted to spend just a few minutes at the outset kind of giving you a bit of a lay of the land and thinking about what kinds of questions typically get asked and answered, and how the research gets carried out within transplantation. So qualitative studies remain a fairly uncommon mode of research in comparison to the larger field of research within transplant science. Although there's a growing interest in qualitative approaches that's been spurred in some ways by the recognition of the importance of patient-oriented research outcomes and collaboration and co-design of research with patients, donors, and families. And this is sort of one of the things that has pushed people in the field toward carrying out more qualitative work. Qualitative research is really well suited to exploring a range of behaviors, attitudes, beliefs, and values, because this kind of research focuses a lot on how people make meaning, what they understand from different kinds of perspectives, and also the impact of social context on health-related outcomes. So in transplant research, even though the scope of qualitative research, what it takes up in terms of the field of research is narrow, it really does take it looks at a broad scope of issues. Most commonly, this has been quality of life, issues around adherence to medical care, and then also recipient and caregiver, as well as donor perspectives on a range of issues. So things like extended criteria for donor organs, various kinds of interventions that might get carried out. And so perspectives on clinical care and interventions. On the whole, the approaches to qualitative research can, though, be somewhat narrowed, especially when the research is kind of embedded more in the health sciences. So the kinds of ways that people might carry out qualitative work in transplant tends to be through focus groups and interviews. Less commonly would be phenomenological studies, an approach to qualitative research called discourse analysis. Ethnography is less common from the health sciences side of things, but there is sort of a whole branch of anthropology that is interested in transplantation. Very uncommon would be things like performance studies, film studies, that sort of thing. And then I would just sort of, have a nod to pediatric transplantation research, which does tend to include more play and arts-based approaches in part because of the age of the individuals, and that these kinds of approaches are more likely to be used in certain clinical interventions for pediatric populations. Now, it's important to understand when we wade into qualitative research that the kinds of questions that we ask and answer are often informed by the disciplines and the disciplinary approaches that surround them, and that because these come along with certain kinds of methodological considerations. From a lot of the health sciences, though, there's not always a clear theoretical framework or clear theoretical orientation that the qualitative research is taking on. And I would say, and this is in juxtaposition to the work that is done from the disciplines of things like anthropology or sociology, where there is, a theory-driven foundation to how transplant is studied, particularly, things like transplant practices. These tend to be more theoretically sort of framed. The work in anthropology and sociology has tended to focus on embodiment, concepts and metaphors of gift giving and kinship, as well as self-other relations. And then in anthropology specifically, there is sort of a branch of the work that attends to the global traffic in organs, to things like medical tourism and immigration and post-colonial histories that impact transplantation. And then in terms of the intersection with things like the arts, in Canada, there's a very small, there's a very small group of people who are doing this kind of work. One of the earliest projects that was more explicitly embedded in the arts was the Hybrid Bodies Project, which was based out of UHN, focusing in heart transplantation. To our best assessment, the qualitative research seems to be more predominant in kidney transplant, followed by liver, and then heart and lung transplant. And this may simply track with the volume of organs transplanted and the size of the different programs, but it's also possible that because qualitative research often relies on engagement with people on talk and on text, that it's a little bit more feasible when you're working with people who have a sort of slowly building chronicity to their illness, where there's different kind of ranges of acuity, and where the technologies that they might be interfacing with in order to get to transplant require less sedation. So, for example, if you imagine a study about being listed for transplant, it's certainly easier to talk to people who are on dialysis compared to people who are ventilated or on ECMO. And to our best assessment, there's, I think, in terms of areas of work to be done, there's really not a lot that has been done that's looking specifically at how technologies and scientific knowledge are produced and experienced, really kind of interrogating the social context of medicine and science specifically. So in terms of the qualitative research and the way that, we're asking specific questions that are, often complementary to quantitative forms of research, you can think about this through the example of something like adherence. So epidemiology would be an approach, like a large cohort study could give you a picture of who is adherent to medications or who is having challenges with adherence and maybe some of the factors that are risk factors for non-adherence. A randomized control trial is the kind of thing where you would actually test an intervention, let's say, for adherence, but a qualitative approach would give you a better sense of what adherence means to somebody and the ways that a particular socio-political location is going to impact adherence. Now, I think that, what I really want to kind of drive home here is that different research methods are going to orient us to knowing the world in different kinds of ways. So with qualitative research, there is also sometimes a distinction that's made between critical qualitative research versus more descriptive work. The critical qualitative research is research that tries to understand processes, events, and relationships in the context of a social and cultural situation. And it asks how people make sense of their experiences, but it asks it in a way that also pays attention specifically to the relationships between knowledge and power. And while it prioritizes subjective experiences of participants and researchers as relevant data, the methodologies are really interrogating how knowledge in a field is being produced in some kind of way. And so it goes kind of beyond the descriptive. In terms of the kinds of elements of critical qualitative research, on the screen in the orange, I've got sort of a list of different things that people might be kind of thinking about or talking about in terms of critical qualitative research. So there's some kind of emphasis on particularity, on local context. There's often aspects of the analytic work that are about thematic and interpretive kinds of approaches. In terms of the sorts of things that we might be looking at, we're looking at discourse, so how talk and how text are produced, how they're circulated, how they're structured by sort of institutions and practices that surround people. There's also, often an emphasis on narrative, so people's like storied kinds of experiences. Usually this is work that has some kind of social and historical kind of situatedness. And a lot of times, almost, I would say almost universally within critical qualitative research, the researchers themselves are paying attention to their positionalities and their relationalities within the field of research as they are gathering data. Now, when people are engaging in this kind of work, there's multiple layers to the intellectual effort that's being undertaken. So first, you've got a very specific kind of worldview or ontology that's being presumed. And that worldview translates into an understanding of what can be known and what counts as data. And then that in itself will determine what the research praxis is. So how you go about collecting data depends on what you think is meaningful as data. And that sort of ties back into the worldview that you bring to this study. And then finally, there's an ethical component to this type of work that also flows from these three things, from the ontology, the epistemology, and the praxis. And that ethos relates to how you engage with participants. So for example, if you see participants as collaborators rather than as sources of data, that also orients a different kind of set of approaches and methodologies. And that also is going to shape how you understand things like power structures and social inequities that might be part of your field of study. So if qualitative research asks about people's experiences, even at a descriptive level, critical qualitative research uses the analytic tools to read that data within a theoretical frame that's going to question the prevailing assumptions, and that acknowledges the role of power and social position within a study. So I want to talk a little bit now and shift into talking a bit about the Frictions of Futurity project, which is the work that Brad and I are connected together on. And I threw some words out here that may or may not be familiar to people. So crypt technoscience, we talked a little bit so far about my background in feminist science and technology studies, and arts epistemologies. And these are the kinds of theoretical frameworks and background sort of assumptions and epistemologies that shape how it is that we're undertaking this project. So crypt technoscience is a branch of critical disability studies that's interested in a compulsory or cultural imperative of compulsory able-bodiedness. And it's interested in the proliferation of capacitation and enhancement technologies, and the ways that this can make it difficult for people to opt out of normalizing interventions and treatments. And so crypt technoscience aims toward understanding how this plays out in different kinds of spaces, and it looks toward transforming an ableist kind of curative imaginary that drives a lot of the rehabilitation sciences and medicine. So it politicizes the relationships between people with sickness and illness and disability and the technologies that are meant to enhance their lives. It looks to improving access also to technologies that can enhance quality of life, while recognizing that disabled lived experience is a source of knowledge. We also have some work in this project that is deeply tied into feminist science and technology studies, which is really considering gender in relation to the production of scientific knowledge and technological innovation. And it thinks about that in a very intersectional kind of way. And then arts epistemologies are an orientation to arts-based practices that aim to understand and identify how artistic creation can reveal new insights and new knowledges and new understandings through associative, nonlinear, sometimes non-representational ways of engaging creatively with the subject. And so these are the kinds of things that inform the project that we've developed and are undertaking now. And that project, is really guided by a question that's asking what futures can materialize when transplant medicine is brought into conversation with a critical stance that's questioning presuppositions about life, livability, difference, and thriving. So we're really interested in trying to address central challenges that span the temporal flow of transplantation. So challenges from waitlisting to adherence and to kind of acute and critical care experiences to then in the survivorship sort of aspects of transplantation, including the sequelae of graft failure. And we're interested in the ways that in medicine is often this sort of temporal kind of linear temporal flow from diagnostic to intervention to cure. And we're interested in trying to use these sorts of theoretical frameworks to trouble that flow. I want to say just a quick word about what the curative imaginary is now, because this is a major kind of orienting concept for us, and it shapes what kinds of things we're looking at within the project. And so in the Frictions project, we're exploring what Alison Kafer has termed the curative imaginary, and that's an understanding that that not only it's an understanding of intervention and of medicine that not only expects but assumes intervention, and it can't imagine anything else. So when you it's a set of interpretive frameworks, practices, a disciplinary matrix that orients toward cure as the only rational possibility. Disability is always uncontroversially a problem that needs to be solved, and medical intervention is inevitable and desirable within this imaginary. And so we see this across all of medicine, but we're especially interested in how this plays out in transplantation and the ways that this kind of actually butts up against what a lot of clinicians and patients and families experience, which is that they often acknowledge that transplantation means that they're trading one chronic illness for another chronic illness. And there's this, and so we're interested in trying to look at how there's some frictions around this idea of cure within transplantation. And so friction is also an orienting concept that we're using. And friction is about, like, following friction is about trying to look at these kinds of tensions. Where do they exist? Where do they play out? How do they impact the kinds of ways that people experience the healthcare system? They experience their relationships within, say, the transplant programs. So following tensions and following frictions can be really generative. It's how we can look at the way that they shape pathways of care, actions, how it informs meanings that people make of their clinical encounters. From a methodological standpoint, I would say that this can often look very patchwork and haphazard because it's often emergent. Following frictions is about following encounters, and so a lot of times this can be the kind of thing that you can't a priori sort of lay out exactly what it is you're going to do. And that actually lines up really well with the work that Brad's going to be talking about shortly, which is the practices that he's involved in research creation. This is the kind of work that we're doing really takes a ton of collaboration. So I've tried to just sort of list everyone here so you can get a sense. We've got sort of different kinds of, there's an overarching project, there's an offshoot that relates to liver transplantation, there's an offshoot that relates more to kinship and donation. We have community arts collaborators, we have artists, we have graduate students, postdoc, Brad, we have lots of collaborators across psychiatry, transplant medicine, and the social sciences. And we're all kind of in this together, trying to figure out what we're doing as we go. I want to tell you I'll take just a couple minutes to kind of set up what Brad's going to talk about, which is to tell you a little bit about the sorts of things that we're doing within the project. So first, we've been conducting a discourse analysis. So that's an analysis of text and the way that the text has been created, how it's taken up, how it circulates. And that text that we're looking at are actually patient manuals that are used in the UHN transplant program in Toronto. And this is an example, this is sort of one example, which is from the liver transplant program. So the liver transplant manual, which is designed to try to bring people on board to what's about to happen to them if they're being considered for liver transplantation. Discourse analysis helps us understand what is speakable in relation relation to transplant experience, as well as the ways that people's subjectivities as a transplant recipient or potential transplant recipient are being disciplined through things like sanctioned discourses. So within this analysis, Brad has actually been, one of the things that we had been doing was looking at how, we're initially thinking about the structuring of the manuals and how that actually structures people's experiences in transplantation and brings them into the ideas of what a good transplant patient is supposed to be like. It's meant to prepare them for the transplant journey. And yet, as we were, analyzing the work and also looking at the manuals in relation with people who've had liver transplants, there's a way in which the uncertainties abound and the manuals do not actually do what they're intended to do in terms of preparation, but they do create a sort of structure for how people know what to do to be a good patient. And with this work, Brad was also simultaneously talking with us as we did the discourse analysis, and then did a reconfiguring or a rendering of the manual through poetic work. And that poetic work has really enlivened and made very palpable the affective content that is part of the manual, and has kind of, as we've seen Brad's work unfold, we've really appreciated the way that even our discourse analysis was kind of flat and flattened the experience, and that what you see from the kind of poetic rendering of the manual is a much more affectively charged kind of preparation that might actually be more helpful for people to be able to engage with in preparation for transplant. I'll just kind of quickly talk through a couple of other things that are going on. We have a digital storytelling component to the project where we're doing online workshops with participants, in this case right now from the liver transplant program, but we may expand that to some other areas of transplant, where participants are working with 3 filmmakers and a number of researchers, including one of the filmmakers who themselves has a liver transplant. And they're all creating digital short films telling some aspect of their experience. And what we're trying to do within this work is really move away from the kind of cultural templates that shape stories about transplant. There's a way to tell your story about receiving the gift of life, and we are interested in trying to complicate that through the digital medium because of the way that this actually lets you layer in different kinds of images, sound, play with temporality, and be able to express something in a more complex way than telling a story that has a straightforward beginning, middle, and end. And so we're looking to, so the artistic practice and the filmmakers have been working with the participants to try to explore their stories in a way that embraces kind of a multiplicity of understanding and sort of lets people hold things that are normally quite dissonant from each other sort of simultaneously. And so that's going on right now, and we're really excited to see kind of what comes from that. We're also doing work in ethnography. So the overall framework of the project is ethnographic. And so we are trying to also expand what happens within ethnographic methods. And so we've been looking and interested in the culture of transplant medicine and the field of transplantation as a site where social knowledge is produced, and trying to explore that in a sensory kind of way. So a sensory ethnography is a study of culture that really considers socially situated meanings through sensory and affective modes of expression, and pays attention to the senses as a source of knowledge, and the senses, kind of broadly speaking. And so we were looking to ways within the interviewing practices that we were doing to really try to get into that bodied sensory kind of experience. And this, what you see in the screen here, is a foil cast of someone's hand, which was created in relation to someone exploring the sensory modes of their experience. And then people are invited, as they explore the sensory aspects of their experience, say in transplantation, they're invited to then modify the cast of the hand and work with it in different ways that tries to sort of dig deeper into that embodied experience. And I think some of the things that we've been finding really exciting about this are the ways that people themselves, so participants, are very surprised by the kinds of things that they start to think about and explore as they're talking about their experience while they're in the midst of making the cast and also modifying it. And in ethnographic field research, it's often these unplanned moments of surprise that are most telling of the political and social world we're embedded in. And so sometimes we refer to these as revelatory moments, and they're really worth attending to. And so we were trying to create a kind of sensory way to generate these kinds of things through a kind of creative making practice. We have some work that we've been doing with a colleague of Brad's, a sound artist, Jonathan Kachuk, and he had come to the University Health Network to do sound recordings with us, and is going to be creating a kind of an immersive sound montage that we'll end up having as part of our study data. And Brad also is going to be working with some of the sounds that we've recorded. We have artist talks, and we also have 3 artists in residence who are part of the project, who are working with the researchers and the study data and their own experiences in transplantation to create, in one case, a feature-length documentary, and then in the other 2 cases, installations and performance. And then we're creating these sort of public spaces for discussion about the artistic renderings of transplantation. And here's a photo from the first multidisciplinary salon, which was called Multimodal Imaginings of and the Frictions of Cure and Transplantation. And this happened last week. If people are interested, we'll keep you up to date on when other events are happening. But the idea with the multidisciplinary salons is really to try to create a space where different kinds of artistic works related to transplantation can come into conversation with one another. And we actually are studying the process of the salons as well, to be able to look at how, when that knowledge, artistic knowledge, is sort of put out into the world, how does that sort of, how does that change and generate new kinds of understandings? So in terms of that, we have illustrators who are part of the different events that we're doing in this. The purple image, there's an image with a purple background. There's sort of linear kind of markings that look somewhat like hands that are sort of joined together. There's sort of a central shape with pink and green and black that reflects has sort of vessels, as well as a kind of a rendering of a heart, as well as a number of other kind of designs. And this illustration was created during that first salon, and was created live online for people to interact with. And again, it's a kind of way of understanding what's happening within the event through these other kinds of modes. And then I'll just sort of point out these other 2 images were things that people in the salon, so members of the public in the salon, contributed to our study field notes. So often in ethnographic research, the researcher has this sort of central role and is the vehicle through which data is generated, especially when they're reflecting on their experiences in the field through field notes. And so in this case, we're trying to kind of collectivize that process by inviting members of the public who are interacting with different events that we're doing to contribute their own sketches and their own field notes about the events and their own renderings of and reflections on what has happened, and contribute those to the project in terms of the data. And so then we'll continue to work with that. And so I want to turn it over to Brad. I hope I haven't taken too much time, but I want to sort of let Brad so I'm going to stop sharing now and turn things over to Brad to be able to give you just a deeper taste of the kind of artistic work that's going on within the project.
Okay, great. Thank you. Whoops, what's going on here? I need to close this. Sorry, it just keeps jumping into this presenter view. Second here. I'm just trying to find I might have to share desktop, and then here, maybe this will work. Is it sharing my, it is sharing the screen?
It is. Yeah, it looks
Okay.
great.
Okay.
Yeah.
Okay, good. Sorry.
Nope.
Yeah. Okay. So yes. So I've been approaching this project as a visual artist. I'm, academically trained, but when I was invited to be part of this project, I said I really want to engage with it artistically, and kind of what that really means for me, and this is kind of one of the central ways that I try to work within my art practice, but also work within my scholarly work, is kind of the Zen principle of Zen mind, beginner's mind, which is in the beginner's mind, there's many possibilities, and in the expert's mind, there's few. And so oftentimes when I'm dealing in academic research, and I spent a lot of time dealing in health research now, my doctorate was in psychiatry, there's a lot of expert understandings. And what I found is it often leads to like siloing between disciplines. Like I even remember I did a project, I was the artist in residence for actually Alberta, the Alberta Transplant Institute. This was back in 2015, and I was very young in my career, and I just made I made 2 exhibitions worth of work. And I remember even talking to people that worked in that, and that the institute was very siloed at that time. That's what they were saying, between the different organs, tissues, and so on. It was very siloed. And so it was an opportunity for me to go in and actually make some connections between, kind of the universal experience that was actually going on within that field of work. And as I've gone into do my doctoral work and now my postdoctoral work, this principle of going in with a beginner's mind, which is this open, free region to explore and allow things to emerge, has been really important. And Suze talked about emergence within the project as well. It is something I also approach artistically. Like if I'm grappling with something and I'm running into some tensions, or maybe I'm falling into a pattern where I'm just recreating an aesthetic over and over. The one thing I enjoy as a digital media artist is there's always new mediums coming out, and I jump into that medium and it instantly gives me a beginner's mind. So it's both my academic work that I do, but also my practice. When I don't understand the software, I'm learning and grappling, I don't know what its aesthetic outcomes can be. It's a very, very generative space for me to be in. And I'll be showing you some work with artificial intelligence, which is just sort of emerging right now as a usable artistic medium just since this summer. And it's kind of taken on that primary place in my practice right now, because it is a free zone, like an open clearing to investigate in. So just to kind of situate myself and situate some of this work, and maybe even just awaken some new understandings or dispositions through these provocations. There's always a few ideas on art and what it might have to offer other disciplines. And these are things I share with my art students to help enliven their practice and give a little bit more meaning beyond just aesthetic and skill development. And then also for working with people outside of art context, what art might actually do and benefit their research or just their overall life for engaging with art. So one thing that I always come to, this is a Zen teacher that I followed for a long time. And it's kind of one of the main reasons, both why I engage in art, but also why I engage in health and mental health related artistic practice. And this is from a really exceptional book called No Mud, No Lotus. And I'll just read this quote and discuss it a little bit. So we must remember that suffering is a kind of mud that we need in order to generate joy and happiness. Without suffering, there's no happiness. So we shouldn't discriminate against the mud. We have to learn how to embrace and cradle our own suffering and the suffering in the world with a lot of tenderness. And the kind of the idea is that, the mud suffering is kind of like the compost that or the source from which a beautiful lotus flower of happiness, peace, acceptance, feeling sustained, secured actually grows from. And, in my own life, the reason why this really resonates with me is I've lived with bipolar affective disorder for my adult life and had to go on a substantial healing journey with decades of suffering. And this is very much resonating with what my experience is, because now when I learned how to care and cradle that suffering, which was ultimately through my doctoral work and my artistic practice, and then my family relations and the work that I was doing, a really beautiful life has emerged from that. And when I work with, people that are ill in some kind of way, I've worked with Inuit suicide survivors, cancer patients, psychiatric inpatients. I see how art is one of those ways that can cradle suffering and embrace suffering. And when you put suffering in the world of an artwork, it takes it from being something that is just happening to you and makes it something that can actually be universally understood, that, we all suffer in our own way. And maybe I'm living with bipolar affective disorder and somebody's living with the side effects of alcohol-related liver disease that leads to a liver transplant, or all these different ways. But, there is something universal about that humans suffer. And, the Buddha said that suffering is the cause to bring about its end, that it is sort of, it is this universal experience that is part of how we grow and heal and develop as humans. And so it's very central to my practice, but also very central to how I engage with artistic practice, because it is about making those connections between universal human experiences. And then this is just another way of saying it. This is a quote from one of Bob Dylan's songs: "Behind every beautiful thing, there's been some kind of pain." And I think for me, some of the most effective artworks often carry this kind of dual nature, these things in contrast, these things in strife, and that might be suffering and beauty, that might be suffering and happiness, that it can hold this totality of what it is to be human, because I don't know anybody that's permanently happy, nor do I know somebody that's permanently suffering, but that it is something that we experience that undulates, and sometimes you can be both simultaneously happy and suffering at the same time. Another thing that is, I think, useful to think about with art, this comes from Diane Conrad and Jamie Beck talking about arts-based research, is that art does not produce concepts, though it does address problems and provocations. And it does this by producing sensations, affects, and intensities as its mode of addressing problems. And I really like this, that it kind of, art is this opening. It's not going to solve any problem for you. It's not going to necessarily provide a framework, but it will, address these things, provoke these things in you through the bread and butter of art, which is, it isn't intellect, it's knowing, like a different kind of knowing that we engage with through sensations, affects, and intensities. Martin Heidegger, who's a 20th century philosopher, wrote a really fantastic, almost illegible essay for anybody that reads philosophy or Heidegger in general. There's people that say something very simple in like the most difficult possible way, and then there's people that say the most difficult things in those simple ways. And in this case, he says it in the latter. But he does have this beautiful quote that I think is very, very succinct, which art makes space for spaciousness. And I think that's not something that I can necessarily explain to you, but I think it is a provocation. And for me, this sentence is an artwork in and of itself. And then this is Allen Ginsberg, the famous beat poet, and he has this really beautiful summation of poetry, but also really of art. You can replace poetry with the word of art. Poetry is words that are empowered, that make your hair stand on end, that you recognize instantly as being some form of subjective truth that has an objective reality to it because somebody's realized it. Then you call it poetry later. And this really gets to the heart of what I'm going to start talking about now, which is, for me as an artist, I've experienced the outer universe, the subjective space around me. Right now, I'm looking at plants. I'm looking at my window at these birds eating my mossy Pacific Northwest ground. I'm feeling temperature. Did I just lose my screen, Suze? Did it disappear, or did it just disappear for me? Okay, it disappeared. Okay. But there is this inner universe, and you become this almost sort of an event horizon where between these two spaces, and an artwork is one of those ways from which the inner universe, that subjective space, gains an objective reality through the creation of an artwork, and it holds power. And for me, I think it holds truth, potentially capital T truth, whatever people may feel about me making that kind of statement. And so kind of the way scholarly that I engage with this is through it's really not an emerging field anymore. It's much more established. It was emerging when I maybe started in it 7 years ago, but it's the field of research creation. And there was a really excellent essay written on this in about 2012 that describes kind of 4 categories, what they called family resemblances of research creation, and the kind of the work really grew from there. And so there's a few that we're really familiar with here. Research for creation. This is something that an artist typically would do. They might do aesthetic research. They might look into a topic, and then they're going to make artwork based on that. Research from creation. So something might have been created, and let's say like an art historian or an anthropologist or something maybe is like examining in some way. An artist is investigating it for aesthetic qualities, medium qualities, content. There's creative presentations of research. So a lot of work that I've been part of has been kind of this mode of finding ways to present knowledge and research in creative ways that goes beyond, let's say, like an article, or a peer-reviewed article or something. But the thing that was most engaging for me, and I think this has been the most important jumping off point for the field of research creation, is this idea of creation as research. And so in my upcoming book, I spent a lot of time really trying to figure out what this creation as research could mean. And the way that I did that was by actually just freely creating. For years, I wrote plays and films and made artworks, visual artworks. And really, when I was doing all of that work, I came to realize that what, for me, creation as research is the acknowledgement that the act of creation is a site of knowledge generation. So it's not necessarily about this, like you do research and then you make art about it, but actually the process of making art is itself a way that knowledge comes into being. And then Heidegger talks about this. He talks about how truth can be won through the creation of an artwork. And he uses truth in a different way. He talks about it as the unconcealment of being, like this deeply rooted sense of what it is to be alive. So this has been a very generative working title for me. And so when I first began this project, I was actually just learning computer softwares. I was learning programming languages, virtual reality programs. And then I met the first artist in residence. His name's Fraser. And we started talking about his experience. He had a liver transplant, and he is making this feature-length film that Suze referenced. And he gave me all this footage, and I was really moved by what he gave me. And I decided to make a drawing of him from his footage and just freely explore the kind of mental space, or also the space that maybe I hoped for him, which ended up being something that I wasn't expecting, but was vibrant, maybe hopeful, imaginary, mystical, with him and his medical apparatuses before his transplantation that he would use. And so that was kind of one of the first things. And then taking it into another medium, I started to explore sort of how to add his video footage and then kind of tear apart the image in this way. So there was a static image that was whole and understandable, and then it gets pulled and pushed and pulled from its source material. And so this is just an experiment, but one that I aim to keep. This is kind of like an aesthetic discovery and an effective discovery that I hope to explore further. So, kind of working through the project, I had lots of ideas. Maybe I'll make a documentary, maybe, I'll make a video installation, maybe I'll make an experimental film. And then as I started doing this work and I got engaged with this, the transplant manual that Suze made reference to from the UHN, and started writing poetry with it, I actually saw the benefit of maybe like it, when I was engaging with it, it said a tremendous amount about the process, but also said very, very little about what the patient was going to go through. And I thought this divide was quite interesting. And so I started just engaging with it poetically. Once again, I didn't read the whole manual. I tried to go with the beginner's mind, and I started one page at a time, working my way through. And what started to emerge was this very, for me, visceral form of poetry. And it got me thinking about ways that I could incorporate other digital artworks in this format of a book. And so I started making augmented reality experiments here. So this video that I just showed you, you might see that image in a book, like a printed book, and there might be an invitation to say, hey, take your phone and go over this, and then it'll actually transform that image into a moving video. Or this one, I took a page of the text here and allowed it to a video to, you know, push and pull and tear apart the poetry. And really what I wanted a patient-oriented book. And patient-oriented for me both means you know, something for patients, but also something from patients. And so I think a lot of the work that I've done is patient-oriented, and it's really founded on listening, co-creation, and developing a certain sense of both witnessing and witnessing, like being with an experience. And so, you know, diving between the, like I said, I kind of weave, and even Suze made comments that, you know, a lot of this project is very much kind of a bit of patchwork, and that's what it has been for me. And so this is an example on this side here of me kind of visually engaging with a page. I think it's only like the third page in, but it's an abstinence agreement that you have to, which I think if is changing, or if not, is antiquated now in the actual procedure. But at the time of the manual I was working with, you needed to be abstinent from alcohol for 6 months before you received a liver transplant, which is obviously a big source of tension for many, many reasons. And so I wanted to engage with that. And I just went into this page, and I just happened to have a few days before a conversation with a cancer patient, and he was describing this indigenous teaching, which is also found in Buddhism, that he was learning from his teacher in the Kootenays in BC, which was around this idea of the hungry ghost. And if you've ever read Gabor Mate's book, Why the Pain of Hungry Ghosts, I think that's what it's called, but it's a beautiful book on addiction.
Brad, can I just interrupt for 1 second
Yeah.
and say we've just got a couple of minutes left?
Okay, I'll jump through.
I just want to leave a few minutes for a Q&A, but yeah.
Sure. So I won't read the poem that emerged, but it's thinking through this idea of the hungry ghost that kind of emerged from a conversation, and then emerged thinking about what that experience is like to tell somebody they can't drink for 6 months to get this gift. And then once again, more visual explorations of like playing visually with the pictorial plane of the page, what you can do with a keyboard visually. So there's a lot of experimentations of erasure, of crossing things out, of using punctuation and spacing in visual ways. On the right-hand side, I took this list of common signs and symptoms of liver disease and wrote into it a poem about my uncle, who died of alcohol-related liver disease, cirrhosis, then liver cancer, couldn't get a transplant because of the progression of his cancer, and writing about that, but also writing with my own experience of alcohol use disorder and overcoming that as well. The next thing I'm engaging with, like I made reference to before, I'll just show you these images, is I was taking transcripts that we've been developing in the project, reading bits of them, and then like really meditating on these experiences. So in this one, this patient's describing his experience of the operation and feeling, you know, these hallucinations, feeling like he might have died, you know, kind of passing between these realms of living and dying. And so these are field notes of me kind of working with the AI, reflecting, and then generating these images by giving it text prompts, me describing this patient's experience, and then seeing how the AI program imagines what that experience might be like. And then I go through saying that, you know, this didn't quite capture the hallucination and this kind of realm of the dead. And so I adjusted the prompts a little bit to try to direct the AI a little further. And then in this kind of last field note, I let the AI really, you can let it go loose. It can stay tight to the prompts, or you can really let it go loose. And I just wanted to see what the AI kind of wanted to do with itself if I let it really imagine from these initial prompts in its own direction. And so it made these very kind of heaven and hell mystical responses to that. And then just sort of the central idea, and I'll only show just like a very brief clip to give you an idea. But, you know, I went through a lot of surgeries when I was young, and I could really relate with this sort of liminal space, this sort of thin place between this realm and the next, whether that's living and dying. There could be spiritual components to that. There could be many, many things. And so over the past few weeks, I've been making this augmented reality or artificial intelligence video right now. And kind of what I was thinking about was I wanted to transition between those thin places. So starting in the hospital room with the prompt descriptions of what this patient might have been like in the room or in the operating room. And then I would give it direction to transition into these other spaces. And so I'll let this play for about a minute, and then we'll be done. What I love about this scene is doctors become patients, patients become doctors, like it transitions in this really kind of full circle kind of way. So I'll share that. And then kind of just the direction this is heading is I'm trying to create a, analog publishable experimental book that has these augmented reality opportunities. Suze made mention of like field recordings. We'll have videos, 3D models of what the interior of your body looks like, sounds from the hospital of what you will experience, patient interviews describing certain bits of experience that are definitely not covered in those manuals, to try to prepare people both like physically, mentally, and spiritually for what's about to happen. And so I aim to create a publishable book, but I'm also working on trying to create a Web3, which is sort of the transition the internet's in right now. If you've heard of blockchains and cryptocurrencies and things like that, that's kind of what the internet is building towards right now. And I want to find a way that I can put it in that Web3 realm that then might be able to generate funds for kind of future research and donation as well. And that is my presentation.
Fantastic. Thank you so much, Dr. Berkhout and Dr. Necyk. I know that we're at time. We're right up against time, so some folks may need to leave now. For the folks who do need to leave, I just want to say that next Wednesday, we'll be hosting Dr. Aleem Hirji, and the title of his presentation is Pre-Transplant Malignancy, Factoring Cancer Risk into Transplant Candidacy and the Development of Post-Transplant Malignancy. And the registration link in that little description is now in the chat. For those who can stay, we can do a really like a short Q&A. I feel like folks may have stuff to say after this fascinating presentation, and it was so wonderful seeing some of the work there at the end, Brad. So maybe we can start with the question from Patricia Gongol. Would you like to read that yourself, or shall I do it?
Sure, happy to ask my question. This is fantastic work, and this is so interesting and very much outside of my own area of academic training, and so at the risk of being naive, my question is coming from your comment, Suze, about what makes a good patient and what's communicated to patients through the manuals. I wonder if you could elaborate a little bit on that, and if you've explored with patients what might be the impact of those communications that are perhaps unwitting on the part of transplant programs as to shaping patient experiences.
It's a great question. And the work, I would say, is still ongoing. So I'll probably give a bit of a partial answer to that. The other thing I would say is that the different manuals and different programs, we've had different kind of findings from them, and in part that's because the context of the manual is different. So in doing a critical discourse analysis, we are looking at the text and what is being communicated kind of within the text, but it's also about how the text was created, how it's circulated, that kind of thing. So, and so the different manuals have different pasts and they have different histories, and that weighs into our analysis. So one of the examples, like the work that that Brad was doing with the liver transplant manual, the liver transplant manual is actually in sort of 3 sections. And so one of the things as part of the discourse analysis is that we're interested in the sort of structure of the manuals. And so the manual is, there's a pre-transplant manual, there is a post-transplant manual, and then there's something called a coping manual. And that if you think about that kind of tripartite structure, in addition to the content within them, the structure overall is trying to make linear a kind of progress through transplant that's very much not what it's actually like for people when they are in kind of the experience of transplantation. So a lot of things that that happen to people are very much these kinds of temporal sorts of loops. They're very tangled kind of experience. There's a lot of disorientation. There's a lot of things from the past that come forward into the future, and a lot of people have no idea where they are going to end up, and arguably their clinicians don't also know necessarily where they're going to end up all the time. There's a lot of uncertainty, and yet the sort of whole structure of the manuals, just like the structure of the transplant program, tries to kind of create a sort of linearity to the experience that isn't actually there. And so we've been interested in the way that makes it challenging for people to deal with the uncertainty when there's sort of this sort of structure around them that is trying to force a kind of linearity that isn't there. And it also kind of really concretely kind of makes certain things even more disorienting. So especially things like the acute care sort of stages of the pre-transplant sort of time. Other kinds of findings that we were looking at in terms of that sort of good transplant patient, this sort of relates more to that structure again. So the liver transplant manuals, the opening page of the manual is a contract that you agree to be discharged on time. Like that's like the first page. Like that says something about the experience, right? And then the second page is the alcohol abstinence sort of agreement. Like the whole thing is sort of contracts to start with. And then it's sort of like, here's our philosophy of care, that kind of thing. And that also, and that's quite different from the heart transplant manuals, which were revised a number of years ago, actually in collaboration with an artistic research project called Hybrid Bodies. The transplant manuals were revised with heart transplant patients kind of like leading the way in terms of the revision of the manuals. And so we've kind of been interested in the juxtaposition between the different programs manuals and what's gone into that. And then in terms of other kinds of content, I think one of the things that really sort of has stood out as we've been doing more interviews with people who are recipients of transplantation and their family members has been the way that the manuals also kind of reinforce a certain sort of disciplining of what it is that one needs to do in order to kind of go along with transplant and be read as a good transplant patient. So being read as a good transplant patient means for certain stages that you're going to be quite passive in relation to the healthcare system, and that people will just do things to your body to make you kind of keep up in the program. But then there is a very rapid pivot toward being an activated patient, but activated in just the right kind of way, where you're sort of responsible for managing your medications. And so there's sort of I think the manuals kind of, play back and forth between this sort of active versus passive, the sort of agentic versus docile. And then they don't really actually help people with that pivot. I think the other thing that we were interested in was where there are kind of coping manuals. They've been kind of they're sort of modeled after cognitive behavioral therapy type approaches, and where people often will they're invited to write in their own sorts of struggles and their own ideas for how they might deal with them. But what it ends up looking like is like a big blank. So you got this huge manual that's all about all of the different complications that you might have, which as Brad's poetry work had sort of shown, there's like this huge list of things that that doesn't actually really effectively prepare people for it. And then you've got sort of, you're told to kind of cope with it, but the manual is blank for the most part, because it's like a lot of fill in the blanks. And I, you know, from a psychiatry standpoint, I understand what they're trying to do. They're trying to kind of, again, activate people, but in the right sort of way and without necessarily the kind of guidance. And so then it matters, like, how is this manual kind of interacted with? Maybe it's with someone. You can imagine if someone's using this in collaboration or in relation with, say, the social worker in the program, that might actually be a very helpful kind of thing. But when it really depends on sort of the circulation then and the uptake of it. And so we've been interested in kind of diving into these more. And then especially, I think one of the things to Brad's point too about the kind of creation as knowledge, I would say, we were kind of attentive to the structuring of the manuals and the sort of disciplining of what people needed to be like. And we had sort of this like, oh God, there's a lot of like information and yet it's not really telling you a lot. And we had this sort of in our minds, but it was really in kind of engaging with Brad's poetry that the affective aspects really kind of became clear that was what was missing, like that sort of, and it was through seeing the poetic work that we also kind of came to see that our own discourse analysis was kind of flat too. Like there's a way in which, and so the insight around it's the affective engagement that is missing. That insight came from seeing the poetic work done with the manuals. That wasn't, we kind of had this like inkling there was something to say, but it was hard to kind of put your fingers on it until you actually engaged with the poetry work. So that's sort of an example of the way that the creation process generated knowledge that we then kind of are also sort of feeding into, again, this sort of larger discourse analysis. But stay tuned. We have more manuals to, there's sort of like so much to look at. And again, this is like one little context, right? It's hard to say how would that sort of apply to other sort of programs and other kinds of manuals.
That's incredibly fascinating. It's wonderful. And I love how, just to follow up on this wonderful question, the move to engage with these texts that are, as you're just pointing out, meant to provide some kind of comfort or guidance, and often or sometimes have the sort of opposite effect of being these kind of blunt instruments that one is confronted with that are linear, whereas one's experience is not at all linear and kind of settled. And I love how Brad's intervention of engaging with those texts as manipulable, in this reassemblage kind of way, opens up those areas of experience. And it makes me wonder also, in moments of uncertainty around these processes, and especially with the advent of social media and things like this, it feels like there are many more people turning to each other for accounts of how they've dealt with experience there, for other people's stories. And I wonder if this kind of the reassemblage and the making poetry from the manuals may be not only directed back toward the project, but for patients themselves in a kind of, ongoing sort of publication / note wall, but in the sense that, it feels to me like they would be kind of voraciously interested in each other's experiences, even with these texts, as we are as STS scholars, of course, interested in the text in all these ways, but they are also seem to be a very, and you're doing this wonderful work of bringing them in all of these very concrete material ways where they're engaging with the kind of material landscape of that often, as a patient, one feels very passive in relationship to. It just seems really wonderful. I don't know. That's not even a question. I'm just.
It was. I'm writing notes because I'm like, yes, that's what we're doing. That's what we're doing. We're trying to do that. I'm writing it down so I can. It's really incredible to kind of hear it back in a lot of ways, and it actually does. One of the things that we are trying to do is also figure out different ways for clinicians as well, like other hospital staff, as well as sort of patients and their family members to engage with some of the different things within the project. And so some of that has been paired up with Tangled Art and Disability, which is a gallery in Toronto that that is a disability arts sort of center and gallery. But we were just sort of like mulling over today about whether it's possible to create a kind of installation in, say, a room, like on one of the wards, or in sort of the clinical space, and where people can kind of interact with it. And then Lori and Patricia here also know that one of the other things that we're doing is bringing some of the different kind of materials that we have been generating within the project to the CDTRP conference in December, and then also creating a kind of space for people to engage with it, and then let us like kind of document their engagements so that we can also have that kind of within the study materials. And then I don't know if the folks who are here who are connected to CDTRP know or remember this, but we've been working with illustrators. And so one of the other things that we were doing was doing some analysis of the recent patient, donor, and family conferences that have happened. And so we've been working with, so we did sort of an analysis that was like, watching the recordings, looking at the text from it, and then we had started working actually with an illustrator to illustrate our sort of findings, which we are going to, I'm hoping that we can connect with some of the people from the patient, donor, and family steering committees, and sort of have their feedback, and then kind of put that out to the larger kind of group around, here are the ways that we've been watching kind of things transition over the scope of the or over the sort of temporal span of these different conferences. I see Lori's comment. Thank you so much, Lori. I will make sure that I make note of Sean's work. But yeah, we've got lots of, and I think that's the thing, from like as a science and technology studies person, like I'm really fascinated by the materiality of things, and like how can you kind of bring these things forward, and then what happens when you start to kind of try to mess with it, and then how can you also kind of follow the mess that is there, that often gets sort of coordinated and smoothed over, and doesn't sort of show up necessarily when you have sort of other types of studies. So that's the the kind of orienting sort of work that that we're doing. Oh, good. Patricia's saying that in the chat, they'd love to hear more about the PDF form analysis. We're almost done. We're almost done. Our illustrator is just in the midst of kind of finishing up some things. And then my plan is to bring it actually to the CDTRP conference and post it within the discussion lounge, so people can look at it and interact with it.
Fantastic.
And then I think Brad's work is going to continue through the next year. And our hope is toward the project, or at least this phase of the project, will kind of be wrapping up by sort of December 2023-ish. Although we have a bunch of different kinds of things planned, kind of going beyond that. And then our hope is to have a chance to sort of showcase Brad's work through things like public installations, as well as the work of the other artists and residents. And then we'll be able to screen some of Fraser Best's films that he's been making within the project too.
Fantastic. So we're at 1:15 now. Unless anyone in the room has any objections, I think, we're going to call it. And
thank you so much,
everyone. Thank you so much for this really wonderful and thought-provoking talk, and just an amazing project. I'm so happy to hear about it, and would love to stay in touch. And thank you everyone for joining us today, and hope that you come back next week.